of autistic traits in individuals experiencing psychosis. I haven't been an autism researcher for very long, though I'm quite old. I worked previously as a chef, and before that I worked in international development. But I'll hand over now. Sarah, do you want to nominate who's next?
Yeah. So Emma, could you introduce yourself next?
Sure. Hi, everyone. I'm Emma Nielsen. I'm a final year PhD student at the University of Nottingham in my last couple of weeks of writing. I've also worked as a research assistant, co-researcher and project lead on a number of projects broadly around mental health, including autism and mental health. I'm also an autistic adult and have been consulted on a number of projects and involved in a number of projects in kind of that capacity. So can probably reflect and bring a bit of that angle too.
Thank you so much, Emma. Could you introduce yourself next, Audrey?
Sure. So hi, I'm Dr. Audrey Linden. I'm just kind of about a year on from Emma, so I finished my PhD at the end of last year. And that was not anything to do with autism, it was in psychology, but it was around meta-analysis. But then for about the last year or so, I've been, my main kind of job has been as a research fellow with UCL. So I've been working on a big sort of Cochrane review, which is a systematic review and meta-analysis of essentially any intervention that might affect the mental health of autistic people. So it doesn't have to be aimed at that specifically, but anything that might affect autistic people's mental health. And I'm also an associate lecturer at Northumbrian University. So I'm based in Newcastle, even though I have a job that's also in London. So.
Thank you, Audrey. And Jacqui?
Hi everyone, I'm Jacqui Rodgers, slightly longer in the tooth than the rest of the presenters here. I finished my PhD last century, believe it or not, but we won't dwell. So I'm based at Newcastle University in the autism research team there, and I have a particular interest in mental health as experienced by autistic people, both children and adults. And I'm involved in a number of projects around that particular theme. I have particular interests in, I guess, two aspects of work. One is how we get better at identifying the mental health experiences of autistic people and how we can develop better assessment tools to enable us to better capture some of those experiences more accurately. So spend some time working on assessment and the development of assessment tools. And I'm also really interested in trying to get better at developing and delivering psychosocial interventions for mental health for autistic people. So I'm involved in a number of intervention treatment trials around that particular topic, and do some work with Sarah around suicide in autism too, which is fantastic, and it's been great to collaborate with Sarah and learn lots from Sarah about that.
Thank you so much, everybody. So we're from quite a few different sort of areas, and we use a lot of different methods. So I thought that we could start with discussing what are the main issues that we need to consider when conducting autism research and or co-producing research in partnership with autistic people in the COVID-19 pandemic. So I'm going to go in the same order, and I'm just going to ask each of you that question in turn. So if I start with Mirabel first.
Yeah, so there are loads of issues, but I'll just try to not talk for too long. But the yeah, I mean, research typically takes a long time to get up and get started, and then takes place within quite rigid frameworks. So actually adapting to a sudden change is difficult as researchers, and certainly something that we're not used to. I think all of us, and certainly for me, I would feel very important that the well-being of participants is the most important, but not just in terms of protecting from harm, but actually making sure that research is a positive experience. And that was certainly very challenging at the outset of the pandemic, when it was hard to tell sort of how everybody was. And then there were issues around being able to do that, around what are the priorities for for organisations that might be helping us find participants, how is our own well-being and our own family priorities as researchers, and then also about the topics of our research. I think what constitutes a sensitive topic may be different in, it may have been different in November last year, for example, versus thinking about it in March at the time of this year. I guess I'm saying that particularly from the point of view that I designed a project that was designed to be very positive, talking about social belonging and connectedness, whereas actually one of the things that we were suddenly really worried about was people feeling really, really socially isolated, and was it okay and ethical to be asking that question, what we would have assumed to be a positive experience for people, then potentially being a not positive experience for people. And I think as researchers we're not used to having to just deal with that level of uncertainty all at once. Just to, I guess, to say, because I'm also very committed to making sure that the research we're doing is relevant by working in partnership with people, but obviously those people that we rely on for that partnership are also individuals with their own roles and family responsibilities and work priorities during the lockdown, and actually that influences to what extent we can call on people and they're available. But that's just a few of the issues that I've come across, if others want to add.
Yeah, thank you so much, Mirabel. Could I ask Emma next?
Yeah, I'd certainly echo some of what Mirabel's been saying around kind of ethics and thinking about kind of things that may be ongoing or projects that we have kind of in line coming up, and thinking about what isn't feasible. I think with the work that I do, so my PhD and a lot of the work I've done has been around self-harm and suicide prevention work. And so there's been concerns about kind of what we can ask of people, how we can make sure that we're doing this in an ethically robust way, and making sure that kind of people have access to the kind of normal support networks or activities or distractions and things that help them. So making sure that we've kind of thought about those things, and if needed to press pause on things while we make sure that everything's in place before thinking about perhaps, okay, we now feel in a position to think about what can be going ahead and what maybe can't be. And I think another important part of ethics is thinking and being really clear about what we can deliver and in what time frames. So we've seen kind of a wealth of research pop up around COVID specifically and people's experiences, but really thinking really carefully about what are we going to do with, if we start that research, what can we do with those results, how can we action them, and being very, very clear with people so that they can do those kind of almost cost-benefit analysis for themselves when they're thinking about whether they want to take part. We've all had to be a lot more flexible in terms of our ways of working. So a lot of things have kind of moved into online spaces, which might be great for some people. They might present additional challenges. So I know that, just as an example for myself, as much as I sometimes love an online meeting, sometimes I find the turn taking really confusing in an online space that I don't so much kind of in person. But for some people, online might be brilliant, and certainly we need to think about, if things are working for people, how do we translate, does that translate across, and how does it translate across kind of afterwards in a kind of post-COVID world, and kind of how we best work with people. And I think like the final kind of challenge that I bring up is just the rate of change of things. So obviously initially there was a huge change for us, for people that we want to be working with, people that are working with us as partners. There was a huge amount of uncertainty and things to get used to, but it's an ever-evolving picture, and kind of remembering that and thinking, I guess it's a challenge of trying to check out where we're at, but also acknowledging that picture is changing over time. And so being really aware of the fact that people's kind of needs and people's capacity to engage and people's willingness to, and is likely to change as well.
Thank you so much, Emma. Audrey, can you tell us a bit about your experiences of research?
Yeah, so I guess for me it's been a little bit different because I'm kind of aware of all the stuff that's going on for all the people doing primary research, but most of what I've been doing day to day hasn't really changed. So we're doing all sort of looking at secondary data for a systematic review. So all of the day-to-day stuff of that job has kind of stayed the same. I mean, all of the pressures that the research team have been under has obviously shifted and changed, and everybody's now got different, things going on in their lives. But I was already doing the job remotely, and some of the other people on the team were also already doing the job remotely. So I think the main kind of thing for our work that we're doing is going to be just considering sort of when we're updating all our search results and everything, well, what research has been done while coronavirus has been going on and while people have been in lockdown. So, if we're looking at anything that might affect people's mental health, if some big change like this has happened, then we need to kind of consider what effect that might have on the research results, and then what we're going to do about that, and incorporating that that research into the systematic review. So it's kind of a little bit of a different perspective and different angle to other people, but yeah, that's kind of how it's affecting things from this side of things.
Thank you, Audrey. It's so interesting to have that different perspective of different kind of research methods. Jacqui?
Yes, so as Mirabel and others have said, so many things have changed on so many levels. It's almost hard to kind of, pick out key points. But I guess, we had a number of studies up and running at kind of various stages of development or kind of data collection or follow-up when lockdown hit. And we had to think really quickly about what to do. And many of those studies are mental health based studies around anxiety and supporting either autistic people directly or family members, so parent mediated interventions. And we had people at different stages of research, from consent through to kind of follow-up, and people in the middle of receiving psychological interventions via our kind of therapy teams. And it felt that we needed to really think about how we manage this situation, because actually just closing down those studies when people have kind of invested in them or potentially relying on access to the support that they may get from those studies seemed to be a really significant factor that we needed to think about. So we had to move really rapidly to try and see whether there was alternate methods that we could use to undertake those assessments and follow-ups, but also deliver the psychological therapies that we'd kind of committed to being able to deliver to those individuals. And I have to say I'm very pleased and proud of the team to say that, we have kept going. It's been a real, very, very steep learning curve for all of us. None of us have ever been in this situation before. Who could have predicted it this time last year? So we've had to take many steps, in terms of going back to ethics, to think about different ways of working, different delivery methods, different assessment methods, thinking about governance issues, thinking about the platforms that we're using and what's approved by one trust versus another. So lots and lots of complexity around that. And of course, we've had to try and keep communicating with participants and families throughout that to try and make them feel as if we're holding them in the forefronts of our mind and actually really trying to make things as good as it could be. And then that's particularly against a background of the fact that, for a lot of people, support services that they may ordinarily have access to kind of, dropped away as focus changed within clinical services. So trying to kind of respond rapidly to a very changing environment, I think, has been a huge challenge for our team. And one that, I think we've risen to, but it's not been without its challenges for us personally. And I know that, so, you know, there's the issue around kind of supporting participants who are helping us with research. I've also been really mindful of this kind of issue around the impact it's having on our research team, many of whom are now working from home. They are conducting assessments from home with individuals around their mental health, and actually maybe sitting with the information that they're receiving a lot more than they would if they were in our base, in our department, and able to talk, you know, confidentially and anonymously about some of the material that they've been discussing with participants. And so thinking about the isolation of our research team and the support that they may need has also been very much at the forefront of our mind, and has had to change the way that we've kind of worked as a research team as well. And I guess the final thing that's kind of preoccupying me a little bit at the moment, although I haven't kind of crossed the divide to think about how we're going to manage it, is, of course, the pandemic itself has an impact on everybody's mental health to a greater or lesser extent, depending upon the circumstances that you're in. And because we have ongoing research projects and we're continuing to collect data, we need to be able to think about methods where we can potentially disentangle the impact of the pandemic from, you know, the impact of our intervention, or how we're, you know, how people are kind of reporting on assessment methods. And that's something that I think is going to be really interesting when we get to the point of writing up papers. We're almost going to have a kind of, well, these are the data that we collected before coronavirus, and this is how things were looking at that point. These are the data that were collected during coronavirus, when everything was really uncertain and nobody knew what was happening. And these are the data that hopefully have been collected, you know, after everything's kind of settled back down to whatever becomes the new normal. And how we deal with that is not something that's solvable overnight, but it's something that's going to tax all of us who've been involved in research during this period. Something we really need to think about, I think, as a research community.
Thank you so much, Jacqui, and everybody else for your kind of thoughts in lots of different, very, very different kind of contexts. It sounds like a lot of learning's happening from what people are saying, like having to very, very quickly change your clinical trial or your study to make sure that your participants are supported and that you deliver what you promised to deliver and remain supporting people. And other people have perhaps, like in my circumstances, had to very, very quickly work in partnership with our autistic steering group to decide whether a study can continue or not. So we had a study that was looking at patterns of self-harm, and it was a task that we adapted in partnership with autistic people, but it discusses some tricky topics, and it requires working with a person, you know, in person. And we did discuss, when lockdown happened, with our autistic steering group, would it be ethical? Would it be possible? Is it advisable to do this remotely? And we had a long discussion about it, but we decided that it wouldn't be ethical to do that because of you know, usual support and distractions being closed, just how uncertain and stressful everything was. You know, it wasn't ethical to proceed with that. So there's a lot of kind of learning that we've had to implement, like how I had to learn very quickly and actually consult with my steering group, how will we do co-production remotely? I had to look at a lot of different ways of doing that because it wasn't something that we'd done before, but inadvertently we actually learned that it was a wonderful way of doing it, and there are lots of ways that we actually preferred having a kind of text-based chat. It really, really worked for us in our group. So I'm really interested in hearing about all of the different things that we've been learning about how to address issues quickly, like co-production, ethics, and all of these things that we're kind of coming up against, like with Audrey, with what you were saying about having to take, and also what Jacqui was saying about having to take into account this new kind of bias that COVID-19 brings in systematic reviews and other research and clinical trials. We have bias checklists for lots of other different circumstances. Is somebody going to develop a bias checklist for systematic reviews for kind of pandemics? I don't know what's going to happen. So I just wanted to have a think and a bit of a discussion about what are people already doing to try and address those kind of issues. Does anybody know of any kind of resources that could help researchers who are having to do co-production in these kind of pandemic remote times, or clinical trials, or systematic reviews, thinking about bias, you know, all of these things? What's available that we could direct people to that are listening here? Or is there anything that we could discuss to help them out? So does anybody want to chime in on that before I go to specific people?
One of the things that we've been really, I mean, it's very simple in a way, but it felt like a sort of initial common sense solution is when we've been collecting follow-up data from participants in a range of different studies, which we've been doing largely via telephone rather than face-to-face, of course. When we've been asking about the particular constructs that we're interested in, we've been asking people to tell us a little bit about how they think the current situation may have impacted on their mood or their anxiety or their child's feelings and emotions, so we can at least kind of document that, and we can actually then look at for themes in that. We can look at what the common issues are that people may be reporting, and it also kind of signposts to us which data were collected during this particular point in time. So it's not a very sophisticated solution, but it feels like it's an important initial step to at least ask that question. And of course, we had to go back to ethics to get permission to add that question onto our follow-up interviews. It wasn't something that we could just do straight away. So that again kind of added in additional steps in that process as a team, but then we had to get sponsor approval and we had to get ethics approval to be asking those questions. But it felt like it was an important and sensible initial step to take at the very least.
So Emma, I noticed that you turned on your mic. Do you want to add anything?
Yeah, I was just going to add, thinking about kind of resources that are available and around co-production. Dr. Sarah Knowles put together a nice, it's a Google document, it's kind of an open and kind of live document about digital and remote co-design and some kind of discussion around that. So if it's something that people are kind of battling with or kind of thinking about where to start, it's got some useful resources that people have kind of pulled their expertise together to put.
That's fantastic, and we can share the link to that after this kind of webinar panel, and anything else that we kind of suggest that we're able to share, we can share as well, I'm sure. So is there anybody else that would like to add any other kind of resources that might be useful for people?
I don't really have any kind of specific resources or anything. I was just thinking, like, for our research, actually being able to kind of account for any differences that might be down to the pandemic actually kind of really relies on what Jacqui was saying there. So about people actually reporting, what's happening, what data were collected before the pandemic, what's happened during, if there's stuff that's kind of after any lockdown situation. So for us, a lot of it actually relies on people just being kind of very upfront about, what happened when, and reporting that really clearly, so that, because that's the only real way that we can kind of start to sort of account for things, because otherwise if everybody just reports everything is just kind of continuous and you don't know, what's happened when, that's then going to make it very difficult for us. We'd have to decide whether or not to even include it in something like a systematic review if you've then got that bias and that confounding variable of this big thing happened, but we can't untangle it. So for us, it'll really depend on people like Jacqui really kind of doing that and being transparent when they're reporting things.
Yeah, please go ahead, Mirabel.
Yep. Again, I don't know of any particular resources. I think when I just to say a bit more about what I was doing, I was about to start a community engagement project. So these were all new relationships I was about to start. The project was designed to be entirely face-to-face with local community groups in Coventry. And I got ethical approval about a week before the lockdown, and really it was already not ethical for me to travel from Birmingham, where I live, to Coventry to visit those groups. And yes, in terms of then, so the obvious thing to do was, yes, to go back to the steering group and talk to them about what we do. And the resource I think that was immediately available, I think it's an Autistica guide to organising a remote meetings. And it worked really well just to explore different methods of how we would run our remote meeting. I think we didn't rely on text. People preferred to use video. We had new members in our steering group because some people weren't available. And it was very different to having the meeting within the university. And I think there were definitely, we had real technical challenges, which were sort of kind of a bonding experience for the group. We weathered them very well, and it was sort of quite entertaining. We had a really good discussion about the topic of the research, about social connectedness and belonging and what we should do about it given the current context. And I think because the work I was doing was community engagement rather than formal research, it's much easier within this format to simply say, right, we're just going to document what people are saying they're experiencing at the time. I think, one of the fantastic things about being in a home environment, it was a more homely meeting, and our pets were around, and people, those sort of experiences that you just don't happen in a very sort of sterile university setting. And then the other issue that came out of it, a huge learning point for me, is different ways of using remote technologies to engage people in research. They're not things that I'm familiar with, but as a researcher, I've had to learn to write blogs, ask questions on Twitter, use Twitter polls, and so these are all learning experiences. And I think someone's mentioned it earlier on, but really, it gives us all sorts of opportunities to use these different methods all the time in our research, and not simply to rely on one method, but to think really about using a range of methods to engage all sorts of different groups every time we do research.
Yeah, I think that's really, really, really important. It certainly opened up, my eyes to different sort of ways of doing things, because we just hadn't done the kind of online sort of text-based chat meeting, but it's something that we decided to do together. And actually, it's probably something that we'll continue doing after, the lockdown has ended, to be honest, because it's just so much more convenient and so much more, nicer and more relaxing for everybody to kind of participate in that format. And I was also thinking about what Jacqui and Audrey were saying about asking people in terms of, what's been affecting them at that time. And it made me think, not only in terms of bias when we come to look at our data afterwards, but also making people think about being very, very open when they, report their results. But I found in some of my research, because we stopped all of our kind of surveys at the time of lockdown, because they asked about things like entrapment, for instance, or defeat, which are risk markers for poor mental health and thinking about suicide. But it was just a terrible time to ask about those questions when we all kind of felt, entrapped in the situation. I certainly did at the beginning of lockdown. And we have a kind of an open kind of qualitative text box at the end of all of our surveys that allow people to give feedback on the survey or any other thoughts that they want to add. And we found in this that even before lockdown was announced, that people were saying that their responses to the survey could have possibly been affected by the lead up to lockdown. So I think that we have to be very kind of aware of that when we look at our results. And also, in future, this, hopefully it won't, but maybe there will be, other pandemics in future. And perhaps these little kind of bits of advice and things that we've done in our research now be really, really useful to document for people in the future. Like having, I don't know, like Jacqui, for instance, if you'd had a kind of document that had steps laid out for what you do in a clinical trial if a pandemic hits, would that have been useful?
Oh, I would have, I would have given so much money for that at the very beginning. It would have been absolutely incredibly useful to have that, because we were just, you know, really trying to find our feet. And every time we thought we'd come up with an answer or a solution, then we found there was something else that we had to think about before we could implement that. So for one of our ongoing studies, we were midway through delivering parent-mediated groups. So groups of parents were coming together once a week in, you know, groups of 5 or 6 with a couple of therapists to work on a particular topic. And, you know, we had groups in different parts of the country running in that way. And then all of a sudden the groups weren't allowed to happen. You know, people couldn't meet face to face, but these parents were kind of part way through. So we needed to try and think about, well, what do we do? Do we just stop, or do we try and come up with an alternative solution to try and keep things going? These parents had kind of, you know, bonded really well. They were kind of, you know, saying they wanted to continue with the groups, but we had to find a solution. So we moved to thinking about whether we could deliver the groups in an online format, which sounds really straightforward when you say it quickly, but actually it has a whole host of other things that you need to think about, not least the fact that the 3 NHS trusts that we were delivering the groups through all had different rules and regulations about which platform you could use, which meant that the people training the therapists had to learn things, techie things about a number of different platforms, and we had to get permission, think about confidentiality, etc. And then of course some parents were really tech savvy, you know, and could find their way around a Teams platform really straightforwardly. And for other parents, it was completely alien territory for them. So how do we get people up to sort of feeling confident that they can participate in that way? And, you know, and then what are the ethics and the governance issues about, and the confidentiality issues, and how do we train the therapists, and what do we do with the bits of paper that we would have given in the session for people to take home and read? How do we give that to people? People are not meant to leave the house to go to the post box to post things back to us, and when, you know, discouraged from post. So there's all sorts of things that every time we it was like peeling an onion is kind of a bit what it felt like at times. So if somebody had been able to kind of produce some kind of, this is how you manage a research project in a pandemic, then I would have, you know, paid big bucks for that at the beginning. But I mean, of course, there was nothing like that available. But somebody should be writing it all down before we forget everything that I guess all the stages we've gone through, and hopefully we'll never have to do it again. But, you know, just in case, you know, because we've learned such a huge amount in such a you know, in a very short space of time. It's felt overwhelming at points, and it's felt exhausting, you know, but it's clearly worth doing. But yeah, so somebody quickly make some notes, I guess, would be my advice.
And I think that's what this panel is just so useful for, because it is a way of documenting this. And there is probably, you know, if there is interest of people, researchers that are listening now, like perhaps we can connect with each other afterwards, and this can be an opportunity maybe to get a working group together. Maybe somebody would be interested in writing up those kind of guidance for future. So we talked about a bit about what we've done and some of the guidance that has been produced, like Sarah Knowles' excellent resource on co-production, remote co-production. Thank you for that, Emma. That's a really, really good shout out for that. I've also noticed that they're to do with ethics, like the American Psychological Association and also the British Psychological Society, and probably others as well, have launched kind of statements on ethics for COVID-19 related research. So I'll share those as well. And Emma and I, along with a few other colleagues, Emma Townsend, we wrote a brief commentary in the Lancet Psychiatry about the ethics of conducting research in the COVID-19 pandemic that we can also share as well. That includes some recommended best practice, really, taken from conducting suicide and self-harm and mental health research, and kind of letting people know about that in the context of COVID-19. So say, for instance, asking people before and after they complete a sensitive research study on COVID-19, you know, what their mood is like, so how it's impacted their mood. It's a very, very simple thing to include, but it's really important because some of these initial surveys that came out asking about how worried are you about other people's health, about your health, that I participated in as well, I found were quite anxiety producing, and having distractor tasks and things like that that could be useful. So is there any other resources that people on the other discussants on the panel want to draw people's attention to, or shall we move on to the next, and I think probably last question? No? Okay. So in terms of recommendations going forward, I don't expect us to have all of the answers, but we've actually uncovered a lot of things that we would probably find useful, like written kind of guidance on, you know, ethics in the COVID-19 pandemic, how to kind of adapt your research studies in pandemic situations. Are there any other recommendations that other people would like to see? Any kind of guidance that isn't there yet, but they want to be there? Anything that they're finding particularly kind of challenging to deal with at the moment, or would like advice on, but that isn't really available? Anything like that?
Oh, Jacquie's unmuted. I'll
let you no, go ahead.
Okay. I again, with the not having any other kind of resources or anything, but I guess what I'm wondering is if there's there's kind of two sides to this, in that there's all of the things that have been difficult about it and all the things that have become much more challenging that we've had to learn and whatever. And it's just like, well, there are bits of this that's made much more difficult, but also what can we take from this in terms of, is this actually allowing different types of people to take part in research? Because it's, you know, things are going online, and people who might be struggling to travel to take part in research studies, for example, might be suddenly like, well, actually now this is open to me, I can take part because I can do it from home. And so is there, you know, is there a way of kind of finding a balance in all this to consider, you know, what are the positives, and can we kind of, you know, hopefully we will all move out of this lockdown situation and go back to a little bit more normal, whatever that will look like at some point. But are there ways that we can kind of, you know, how can we think about like what things people are finding more positive from this, as well as what things are more challenging, so that we're not only kind of looking at, well, here's a guide to kind of like what to do if, but also can we take some of these things to potentially try and make research more inclusive kind of going forward. That was sorry, I'll let Jacqui talk now.
So I was going to say something very similar, Audrey, and I think for me there's been some really positive aspects to the way that we've had to kind of think on our feet a little bit. And I guess we've always considered the idea of kind of, you know, doing research more remotely and delivering intervention programs in other formats rather than face-to-face, and have kind of dabbled a little bit in that in the past, but never really kind of launched into it with any gusto. And this has really made us do that. It's kind of forced our arm in a way, and it's actually proven to us that it's possible to do that. And actually we had a number of parents who have joined one of our new online parent mediated groups who probably couldn't have participated had we been doing things face to face, because transport would have been difficult for them, or because, you know, they were at the wrong time and they were at work, and now we can do things later in the day because, you know, everyone's not having to come together at kind of 10 o'clock after the school run, which is the classic time that you run a parent group. So there's been loads of kind of opportunities to kind of think about how we can do things differently, and we've been forced to do that, which I think is no bad thing, because who knows when we would have got round to doing that otherwise. But I think it's made the delivery of our interventions potentially in the long term a lot more inclusive and a lot more available to individuals and to parents too. I guess the caveat to that is I do worry a little bit about the implications of that in terms of health inequalities, and I don't think we should wholeheartedly go down this route of remote and virtual research, because not every person has the access to the resources to be able to participate in that way. Some people don't have decent broadband and can't afford it. You know, some people don't have a smartphone with enough data on it to sit through a 2-hour session. So I would like to see us not just kind of saying we'll go down this route or we'll go down that route, but actually providing a range of choices for individuals. And that seems to me to be the ideal. If we can, going forward, try and build into our research projects choice in the way that people are able to participate, then that's going to be the most inclusive way to do things. So I think that's a really positive message that I hope we don't lose sight of as we move back to things being a little bit closer to how they were.
Yeah, I think that's so important, Jacqui. And I suppose what we're also going to get, because I'm wondering about, you know, why didn't we do that before? And I wonder if it's because in, you know, the research that we do, we have to try and control it, or we feel like we must. So if we're doing a face-to-face intervention or, you know, treatment or randomized controlled trial or study, then that it might affect the results if we also do it online, perhaps. But something that could be really useful from this is that we'll actually have data on that, won't we? So we'll actually be able to show whether that does make sense or not.
I mean, we will by accident have data on that, because of course we have some groups, you know, participants in a number of our studies who completed the study and all of their follow-up entirely before COVID-19, and others who have had a kind of hybrid version where they maybe started face-to-face and they finished online, and then we'll have another group of people who've done it all online. Now, we're not going to have, you know, obviously we didn't plan it that way, so we haven't powered the study to look at those different subgroups, but it will at least give us some initial hints as to whether it makes a difference, and whether it makes a difference, importantly, for intervention work to acceptability and feasibility. You know, because if you can't deliver it in an acceptable way and it's not doable, you're never going to find out whether something's effective. So you need to find out whether it's feasible and acceptable to start with, and we should at least have an idea about that, which, you know, is a happy bonus, I guess, of having to move to deliver things in this way that we never thought we would have at the beginnings of those studies.
So is there anything that anybody else would like to add in terms of going forward? Mirabel?
And yes, just one point. I'm extending the point really that's been made about, you know, offering individual preference, and whether, in fact, our experience of how we've had to all work remotely as researchers during this period, I mean, we've all had to adjust to completely new ways of working, and in fact, whether that offers opportunity to be more inclusive in terms of engaging people as researchers. And I think I raised that point because I'm largely home-based in my research, but actually I have felt much more engaged and attached to my host department during COVID than I have in past times, because I can now engage in seminars online, different interest groups. I can have coffee with colleagues 3 times a week and even go to the pub with them, all of things that were not available to me prior to COVID, because I would have my caring responsibilities and I would have to physically travel there to engage in any of those things. And I just hope again that that can be retained going forward, to really diversify the range of people working as researchers.
Yeah, it's really interesting. I just have one more thing that I wanted to ask, really, and not just the people on this panel, but also the people attending, with this in mind, really, that there can be, you know, positives, that we've been pushed towards doing things that we wouldn't ordinarily do, and perhaps it could widen participation. I wonder what it's been like, if anybody has been involved in co-production during the pandemic, and how the feeling of that has been different in non-pandemic times. Has it been better? Has it been, you know, not so good? What has it been stressful? You know, what has it actually been like? And I was wondering, Emma, because you said at the start that you could tell us a little bit about what it's like to, you know, co-produce research from the point of view of people involved in co-production. Do you have any thoughts on that?
I think from my experience, it's been quite like a team bonding kind of experience in a really odd way. Of at the very beginning of things, we were given kind of the option of whether we wanted to go ahead, or whether we wanted to halt things completely, or kind of find alternative ways of working. And the majority of the group were really clear that actually being part of the group and part of the project was something that they valued. And that was important, and kind of finding ways of working was something that was going to be a challenge, but was going to be valued by the group. So we've had a whole range of options, from kind of online meetings to typing things and sending things in, to pre-recording things to be then played in meetings or teachings and things. So I think there's been a lot of creative thinking and a lot of flexibility, but certainly it feels like it's reaffirmed the value of the group and kind of what we're doing, and also kind of, in a way, kind of unified us a bit more as a group, which has been a kind of unintended positive, but a real positive.
And that's kind of how I felt when, through what I was describing earlier about working with my steering group to decide, you know, should we continue our project? You know, when should we restart it? What are the ethics involved? It really kind of came together. So I feel the same way, which is kind of a nice but unintended sort of consequence of our situation. So thank you all so much for discussing that. I'd like to open up to questions, and I can see that there are 5 questions that have kind of come through, and I want to pose the first one. I think that we can all see them if we click on the Q&A, the panelists can see them. So the first one is, assuming that we're all working in partnership with participants and using participatory methods, many people will have unique needs. My question is about how can you best support participants when you're asking sensitive questions about issues like suicide, considering many of our usual support mechanisms are currently disrupted? Is there anything in particular that you've come across recently which is really useful in this new situation? So thank you for that question. This is certainly something that I've come across, and I'm happy to answer, but does anybody else want to chip in? Any thoughts about this question?
I would just say that there's certainly consideration kind of ahead of time about thinking about what might be useful to people, and kind of what access to support they might have, and what resources they might have kind of within themselves or available around themselves, and really doing that work and thinking about that as part of kind of a risk assessment process or a safety planning process, kind of before you start doing your research. So kind of not waiting until there's a potential problem or you've potentially flagged something. but really working with people to help identify what is around that person, what they do have access to, and there's certainly kind of work around that. So that's would be my kind of gut response to the question.
Does anybody else want to add anything?
Other than just to agree with Emma that's really sensible advice, and I think, you know, also thinking about if you're doing things via telephone or virtually with participants, actually setting up some way of contacting them just to talk about how that's going to work and identify any support systems or usual strategies that they may, you know, that they may use that you could refer to, and almost having a kind of pre-meeting with them, and assuming that things are going to take longer than they ordinarily would face to face. I think that's something that we found too, that it's really tiring talking about things over the phone or on Zoom, and so, you know, things do seem to take a lot longer, and maybe you need to have kind of more contact, more individual contacts, rather than kind of ploughing through something in one sitting, which might be more likely if you were meeting somebody face to face.
Yeah, I absolutely agree as well. And in all of our studies, because we've done quite a few different studies now, asking people about their experiences or talking about suicide either in person, and for some studies online where appropriate, we always have a plan in place beforehand about how we'll safeguard participants, and that's kind of co-designed with autistic people and the kind of group that's specific to the study as well. Which helps a lot. And what Jacqui was saying about talking to the participants beforehand, we do that a lot. So we always talk to people about their participation, how they're doing at the moment, what kind of support they have around them. And at the beginning of lockdown, to be honest, we did pause a lot of our research precisely for this reason, of being very, very concerned that if we're talking to people about really, really tricky topics and they don't have anywhere to go at that time, because it was initially very uncertain about what support would look like, we decided to pause our research. But of course, in other situations, if you have an ongoing study or an ongoing trial, it's a bit different. But then again, you know, you might have more access to support that you can actually give them. So I hope that's useful. Does anybody else have anything that they'd like to add to that?
Just to flag, there's a new paper by Larry Pruitt, really specifically looking at safety planning during a pandemic. So I'm not quite sure how to do the technology to link people to that, but when somebody informs me of how to do that, we can chuck that across as a resource.
That's brilliant. Thank you, Emma. And I'll make a note of that as well, because I'm kind of trying to make notes at the same time. So I'll put safety planning paper. And on our website, we do have an adapted safety plan that we adapted in partnership with autistic people. And if for people who don't know about safety planning, this is suicide or self-harm safety planning. It's a step-by-step plan that you work through with somebody when they have thoughts or feelings to hurt themselves or end their life. And it starts with kind of distractors and moves on to who you need to contact when you have a suicidal crisis. And Jacqui and I have funding starting in September to adapt this and pilot it a bit more as well. So if people want a copy of that plan, then I'd be very happy to share that along with the paper that Emma said. Do we have any time for any more questions, Lorcan?
Yeah, we do. So I was just going to jump in and give people a quick reminder, because I can see we've quite a few researchers and community members have joined. And I guess we all have different perspectives of what it's like either running a research project or taking part in a research project. And one of the things that's interesting for us in the Discover Network is we get lots of people saying, we have this very specific issue, and actually lots of people have the same very specific issue. So this might be a nice opportunity for people to put them in the comments or in the Q&A and say, this is something that we found really useful, or this is something we're really struggling with. Has anyone else found a solution? because often actually it's the same kind of things that everyone's trying to figure out at the same time. So I think if people have any of those, either things that they need advice on, or things, you know, whether it's about how to get something through ethics, or whether it's something that you did that was particularly effective, that was a pragmatic solution, for example, for changing the way that you were doing research. And I guess something that's come through in some of those conversations that's been interesting for me has been some researchers have really commented on things that have gone quite a bit better than previously because of the fact that they were conducting research. So for example, one problem in projects, often trials, is that lots of people sign up at the beginning and then gradually drop out. So some researchers have been talking anecdotally about having better retention rates where people stay involved right the way through. And I was just wondering if that specifically is something that has happened for you, or if there's other things that have been positives for doing research under these circumstances. I guess with the obvious caveats that we don't know that's just because things are online. Also, people have had a lot less going on in life in general, which meant they've been more able to take part in research. Or as some researchers are kind of starting to think about, maybe it's as we have, you know, the chief medical officer and chief scientific advisor to government on the telly every day, that people are starting to really see the value in doing research, and that even research that's not specifically about coronavirus, and whether people are kind of becoming more committed research participants. So I was wondering if any of the panel had any of those positive experiences, I guess.
So as I mentioned earlier, we had in one of our studies a number of families who had initially, maybe, you know, as much as 12, 18 months ago, expressed interest in participating in the study, but then actually not been able to just logistically commit to the time. So, you know, if you think about parent groups, 2 hours a week, every week for 8 weeks, it's a big ask if you factor in travelling time, and it might not be on a day of the week that when you're not at work or what have you. And we've circled back to those families as we've been introducing online delivery of groups to see whether that format actually makes it more feasible for them. And we have found that, not for everybody, but certainly for some families, they've been delighted because it's meant that they, you know, they really wanted to do it and were committed, but actually just practically couldn't. And this has kind of opened up that opportunity for them, which is really, you know, great for us. In terms of dropout and retention, I mean, the numbers will tell us eventually, I guess, but my sense from across a number of studies is that we've not had any less participation or uptake. And, you know, it may well be that we've had a little bit more because things have been a bit more flexible and a bit more accessible to people. Certainly during the beginning of lockdown, when pretty much everybody was at home, we had much more success than usual ringing people up to do some kind of follow-up over the phone interviews that we'd had compared to previously because people were at home. So researchers were getting really excited because they kept not having kind of every 6 calls somebody might answer. It was kind of, oh my God, 3 people answered the phone today. And that's sort of changing a bit as people get back, you know, out and about and to work. So yeah, so I think there's been some, you know, some kind of different patterns of participation, I think. As people have spent a bit more time at home, or we've been doing things differently, which has been opening up possibilities for people.
Yeah, very good. There's also a very specific question that's come in that I think might be of interest to some of the researchers in particular, which is around gathering consent. So some places are very familiar with gathering consent online if they do surveys or online-based research, but I guess some people have been having challenges where they're trying to gather consent for people to take part in clinical trials, for example, where the processes have always been sit down next to somebody with a form, talk them through the really long bit of paperwork, answer their questions, and gather a physical signature. And some ethics boards have kind of been slow to adapt to it being possible to give, you know, check a box online as a consent process when the rest of that project isn't an online survey, for example. So is that something that you've kind of come across in each of your research and something that you might have some experience with? I guess, Sarah, maybe if you want to comment on that.
It's not something that I've actually come across, because a lot of our research has been online. We have done some in-person studies as well. But as I said, in the context of that particular in-person study that was, happened to be taking place during lockdown, we decided to pause it because it wasn't considered ethical to do it remotely at that time. That might change now that lockdown is slowly being lifted, though. But I think that if we had decided that it was ethical to do it online, like by video chat or Zoom or something like that, then I think it would have been possible to have had an online ethics process. So you kind of have the person with you. I mean, surely there's technology to have kind of like a discussion via text, or, like this, like via Zoom or Teams or Skype, and have somebody fill out the form and you see them doing it, and they could probably even sign it in some way. I don't know what other people have experienced, like Jacqui, how have you handled consent in this time for your clinical trials, or was it already done before lockdown?
No, not for everybody. And this is one of the things we had to grapple with when we moved to recruitment to our online group. So obviously there were some participants who we'd consented in the routine way before lockdown, but some new participants who were joining the study during the period of lockdown. And so we had to go back to sponsor and talk to them. So we have an NHS mental health trust who sponsor our research, and we had to discuss that with sponsor about what was acceptable in terms of consent, and got permission and agreement from them through, there's kind of a COVID special, I don't think it's a special measures, but that's the kind of thing it is. It's not the right term, but there are a set of kind of procedures for research in the current situation that enable sponsors to give permission for some adaptations to study procedures. And we were given permission to take consent from parents to participate in one of our studies. Our other studies had already got everybody consented before lockdown, but for this one particular study, we did have agreement to take verbal consent to participate. And of course, the fact that parents then went on to participate is also evidence of consent. But that's obviously something that's a particular kind of special measure because of the current situation.
That's really helpful. So does anyone else want to comment on that? Okay, so another question that's come in is about whether any of you have adjusted your plans for future research. So even thinking about when there aren't restrictions on people's movement, whether there are things that you will do differently because of your experiences during COVID.
Well, I'm not sure I'm best placed to answer that question because I haven't got any ongoing research in the pipeline, but certainly I mean, it just has changed everything in how we work. So I think some of that will be implicit in terms of being able to access the sorts of events as we're doing now, but that these methods will always be available to us, I hope, as researchers in the future. I think one of my questions, the only other thing that I'm doing beyond the community engagement project I've talked about is writing up data that I collected pre-COVID. And I wonder to what extent, I just wonder if the way that I write that data up is now changed because I need to refer to the fact that it was gathered in times before the COVID pandemic and be explicit about that when I write it up. Whereas the other analyses I've done from the same data set are already published without that stipulation. I mean, that's just a question for me in my ongoing research.
Yeah, of course, definitely. And I guess journals will probably, to some extent, start to have some conventions around that, hopefully, so that there's some consistency, at least across studies, that people can use when making those decisions.
Yeah, I think I'm going to continue to change a few things. Like, it certainly opened up more possibilities for how to run co-production in different formats. For example, because our text-based chat just worked so nicely. I think it was there are a lot less kind of demands for everybody, because we kind of decided the questions beforehand. Everybody thought about the questions beforehand. Then everybody gets an opportunity to answer each question. Everybody can be heard because it's written. You know, you can't accidentally interrupt anybody. It's very difficult finding Zoom meetings to know when to speak. I find that very difficult. And that just doesn't happen in text chat. So it just worked really well. So I'm going to consider that a bit more kind of moving forward. Also, what Jacqui and others were saying about having different kind of options to participate. So maybe when we move out of lockdown for the study that I had to pause, perhaps it would be nice to give people the option of whether they want to come in person or whether they'd like to do it online, if they have appropriate support around them, and it would actually reduce their anxiety about travelling a long way to a new place to meet a new person. Perhaps they would prefer to do this kind of sensitive interview in a secure online kind of video format, or even a text-based format. So offering people different choices, I think I'll really strongly consider that more kind of going forward.
Yeah, that's really interesting, and really relates to a comment that we've had come through from Linden, who's saying is, you know, 25 years of experience of taking part in online socializing, and often researchers who kind of move towards doing things digitally, their default is either a phone call or a video chat. And we are a little guilty of kind of overlooking the fact that text chat is another option there, which you might have the benefit of having participants who are more comfortable and, you know, less potential stress, but also, you know, you will end up with a transcript at the end of it. So as a researcher, you're potentially, you know, you might spend longer on the chat, but you're saving research costs on transcription. And I guess it's just about, you know, kind of reminding researchers that this is an option and that there are a number of benefits to it. And I guess as a discipline, we just need to make sure that we have the appropriate ways of combining data in qualitative analysis and things like that, where some of the interviews happen by video chat, some happen by phone, some happen by text chat. And again, just making sure that we have the ways of communicating the fact that multiple methods were used.
Yeah, and I think it's just also important to say that it's important not to kind of just say, well, this is the one method that's best, but just to check with the people that you work with what works for you. Because it worked well for us because we all agreed that that's what we wanted. And we all kind of, you know, co-produced what the rules would be. And I just saw a very quick question that I'm just going to answer before I go on to you, Emma, which is just asking what are the best things from a GDPR perspective to use for text chat, which is an excellent question. I think you have to go with what your university or organization decides is, you know, whatever you should use, because it does differ by each institution, which has made some kind of challenges with, you know, one organization will use Zoom, one organization will use Teams. My organisation, University of Nottingham, recommends Teams, so that's what we would use. But if you know, our steering group said that the colours or the, you know, anything to do with it, it could be the accessibility, that it wasn't appropriate, then we would, you know, talk to the ethics committee and the technical people at my organisation to find something that we would be able to use instead.
I guess I was just reflecting on kind of what I want to do differently or kind of take forwards from this. And without meaning to stress Sarah or Jacqui out, who I'll be working with kind of after my PhD, I think something about challenging the status quo a little bit. I think some things have felt quite static, or it's the way that we do them, so it's always been the way that we've done them, so that's the way that we're going to carry on doing them. And I think that the situation's forced us to prove that we can be a lot more adaptable and that there are ways of meeting people's needs that aren't overly complicated. And I think that's given me a little bit of fire to kind of to stand up a little bit more and kind of, I guess, challenge why things have to be the way that they always have been, and whether we can do better for people.
I hear, I agree.
Well, that's music to my ears, Emma. Very pleased about that.
It's an excellent point. I think so many university ethics boards and NHS ethics boards who spent years telling people that these things weren't possible, and then overnight emailed all of their staff asking them to install the software they banned for years, really just kind of goes to show that, you know, change can happen. It obviously takes lots of work in the background, but, you know, we keep pushing because we know things are going to improve the research and the output of that research, and it's worth pushing for. So we have another question about how, as researchers, we can balance the need to be more inclusive with being pragmatic in what we can achieve, and I guess whether there are particular recommendations or tips any of you would have in terms of, you know, sometimes there are things that an autistic advisory group might suggest, for example, that within the bounds of your research or your department just isn't possible, and how you negotiate that in terms of, you know, if it's, for example, they want to use a particular platform, but your university won't allow that. How do you overcome that challenge where your institution review ethics board kind of disagrees with your advisory group? How do you reconcile those conflicts, which I guess is an ever increasing challenge when we do this kind of research, particularly sometimes online.
I don't mind answering this first, if that's okay with everybody. I suppose I haven't actually had that situation where my, you know, steering group has and partners in my research have recommended something that's impossible. I haven't had that happen. I've had some really, really interesting conversations that have really kind of like opened my eyes to alternative ways of doing things that I just haven't thought about, that could perhaps be a bit challenging, but we have actually always managed to find a way forward. So for example, we had a really interesting discussion in one of our groups about the need to have some kind of standardized tools, even though we recognize that they weren't kind of adapted for autistic people and might not perfectly capture an experience in autistic people. And so that just involved me and, you know, the other researchers kind of saying, well, from publishing the research, this is kind of why we perhaps need to include them, but also perhaps we also need to include qualitative answers as well to identify the aspects that haven't been captured in the measure. And that was kind of a learning experience for us both, really, because the steering group learned what a standardized measure was and the importance of it and why we need to include it. And I also learned more about qualitative research that I hadn't actually, you know, done before, because we'd always used these, you know, standardized tools. So I haven't actually had a situation where, you know, it's been impossible to kind of, you know, include, but I think it's just remembering that you're a team, and you have to kind of co-produce a way forward and answers and solutions together. And sometimes that involves, you know, discussing the kind of limitations and making sure that everybody's on the same page and understands what the limitations are and finding a way forward together.
Thanks, Sarah. Does anyone else want to comment on that?
Yes, I was only going to comment that but really just to support what Sarah was saying, that these co-production forums are just really fantastic problem-solving forums and information sharing forums. And it is, I just sometimes wonder how, you know, there's an enormous amount of bureaucracy and regulation that goes on within universities that you do have to share some of it with your co-producers, and it's not really the most interesting aspect of research. You know, it's much more exciting to sort of talk about the topics and the areas of interest, but I do find that sharing those sort of difficulties, people come up with really, really helpful solutions. And I just wonder if actually, if you got really, really, really stuck, perhaps what you're actually identifying is a research question that needs to be asked. So I'm similar. I haven't had the exact thing where we've been really stuck or completely, you know, where we've had a big disagreement. We haven't. We've come to barriers in the research, and it has heavily influenced the research question in a really, really positive direction, because we've probably identified a really important question to ask. The thing that did happen during this pandemic situation for me was funder requirements changing, and that was very problematic. So the funding that I had for my community engagement project was over a very short time period. It was announced that they would extend the time period to spend the money, then that was changed back again. So we had to spend it in the narrow period. We then had to redesign the project, obviously, to run online, because the time period, the lockdown wasn't going to ease during that situation. And then literally a few weeks before having to complete spending the money, we were told we could have an extra year to spend the money. And in all of that, it has been, I do feel for the co-producers about that constant changing goalposts. But I mean, all you can do is really be honest with people about the restrictions that you're working under, and try to you know, support people with the changes to the plan, but also present the opportunities. You know, in the end, we have learned a lot about how to work online. We haven't had to all conform to the stress of the very tight deadline, and it is the reality of research. And luckily, we work with people who are interested in research and seem happy to deal with the realities of research, as well as talking about the interesting substance and what we feel we've learned. And it is a slow process, research, and we're lucky to work with patient and supportive people, I think.
Perfect, thanks. Anyone else want to comment on that one?
I mean, I've had a kind of, it's a pre-COVID experience, but an experience of the really powerful impact of a kind of co-production group in an ethics application, where an NHS ethics committee were really insistent that a particular project was delivered in a certain way and a certain thing was done during the project, which I knew from having worked with our co-production group isn't the way they wanted things to be done. But the ethics committee were being really quite rigid about that, and was able at this amendment stage to go back to the co-production group and ask for their advice on how to put together my argument to make it happen in the way that they were advocating. And that was a really powerful process, and actually was, you know, very readily accepted by the ethics committee when we kind of put together that we'd done a consultation and we talked to people and we'd kind of co-produced these materials, and these were acceptable to the co-production group, and therefore, you know, there's kind of real strength in that message. And it was phenomenally helpful to have that, the kind of the backup, if you like, of that co-production group going into that that process, because their voice, quite rightly, is much more powerful than my voice in that process, because it was their experiences that we were talking about.
And I've done something similar, Jacqui. When I was in that example that I gave about delaying my research project, I had to go back to the funder and ask for a no-cost extension. And I asked my steering group and autistic partners for their advice in how to word that. And it was so helpful. And they got back to me pretty much immediately saying, yes, that's absolutely top reason for doing this. But yes, it's just, you know, really use your partners as partners and collaborators. They're really, really powerful collaborators and people to have on your side in these difficult times.
Yeah, I'm really glad you've shared that, actually, because it's something that I often try and remind people when they're reluctant possibly to add another step to getting ethical approval, because it's often such a timely process, and they're worried that if ethics have approved something and then that's final, or they know from past experience they need to write something a certain way so that ethics will approve it on first go. But actually often reminding people that if you work with the co-production panel before you go to ethics and they try and say you can't do it this way because, you know, it's not fair on your participants, and you go back and say, well, actually I've worked with the panel of participants who found that you know, a 15-page information letter full of data privacy notices is not actually getting informed consent. And this one that we've written together is much more informed consent, or whatever the issue might be. Then they might just come back and accept it. And actually, in the long term, you've saved time rather than putting extra time on the process. And I think a lot of researchers, I think, quite understandably worry that if you add another step in, it will add another potential source for delay in getting started to your research project. And it's about kind of saying, actually, you know, putting the time in at the very beginning of your project like this is going to be worth it, both in terms of the quality of the project, but also often in terms of the time taken.
Yeah. I also wanted to add one more thing that might, you know, help researchers realise how important it is. But when I first started changing my research really focus from looking at social cognition to mental health and suicide in autistic people, I decided to do it as a co-production piece, and I am so glad that I did that, because it gives you so much more confidence that the way that you're conducting your research is accessible and appropriate to the people who will actually be participating. I just think it's so important, particularly if you're going to do something that's particularly sensitive, but for all research really, to make sure that it's appropriate, and it means that people will participate and they'll have a positive experience of participating, and that's just so important. If you just rush something and get it out there, it won't necessarily mean that it's successful without partnership working.
We have another interesting question coming in about what the discussants' views are about getting back into the office, and specifically whether this should be a priority area for university management. So for those outside of university settings, you might not be as aware about the discussions ongoing around this, but a lot of universities consider that people who do research without human participants, so for example, people who do desk-based research or do lab-based research with animals or cells or something like that, are given access before researchers who work with other people and members of the public. And whether there should be a kind of, I guess, a graded re-entry for those researchers. So for example, as you mentioned earlier on the call, researchers who might find it particularly hard to conduct these interviews at home alone, or researchers for whom online or virtual solutions just won't work because of the nature of the people that they're working. Should they be given earlier access than people who might be able to conduct an online study, for example?
I mean, our university, as I'm sure every university is going through this process at the moment, and it's challenging, isn't it, in terms of social distancing, and all those sorts of things are still going to be in place for some time to come. I know myself personally, and I've talked to members of our team who are really keen to have some time back in the department, and really missing the kind of team spirit, if you like, and that kind of informal social support that you almost don't notice until it's not there. And I think, you know, being able to just kind of check things out with people over the kettle, or, you know, just lean over and say, remind me how to do this on SPSS, is, you know, really, really valuable. So I would be really keen for our team to, you know, be able to move back into working in the office in a sensible and practical and safe way as soon as possible, so that people have a choice, and people won't necessarily be in the office. I mean, they won't be in the office as much as they were previously, and we'll have fewer people in at any one time, but just creating that opportunity for that almost intangible support network that we work in, I think is really critical. It's not just all about Bunsen burners and centrifuges. There's other things, other processes that are involved in research, where being with other researchers is actually quite important. But hopefully, you know, management will listen to some of those arguments.
Sarah, I think we have time for one more question if you want to ask the last question.
So I just saw one pop up, which I'd really like to answer. And it says, it feels like there's good practice in how to involve autistic people in research, but less in involving autistic people in what is a priority for research, and is that a fair comment? I think that's an excellent question, and it is something that we've really tried to address. So Autistica ran a top 10 community priority setting exercise to identify the top 10 questions for autism research that Lorcan will be able to tell you much more about than I am. But I also, along with Jacqui and some other people actually in this panel, ran an international priority setting exercise to ask autistic people and those who support them, what are the top 10 questions that future suicide and autism research should answer? I just think it's so important to run that kind of research. And I've been thinking about this in terms of, you know, what kind of research should we prioritise in trying to help support autistic people in pandemics? Because there's so much research going on right now, but I don't really actually know what the autism community kind of wants us to look at in terms of COVID-19 research. But I wasn't actually really too sure, given the timescales and the way that everything's kind of changing, how we could do that really, really quickly. And there are some other priority setting exercises for mental health, some excellent work being conducted by MQ, but autistic people and people with other neurodevelopmental conditions or other neurodivergent people, they aren't really front and center in those reports. So I was a little bit concerned that this is a little bit of a underexplored area, and that would be something that I'd like to discuss with people in other opportunities during this conference. And it would be interesting to know what the others think as well.
I think I just wanted to add to that, Sarah, that it's really helpful as a researcher starting a project to have those priority setting exercises upon which to pin your own research. You know, one person does it and they do it for the community. And I felt, I hope you saw the mental health session yesterday and how many researchers in that session began by stating that they were addressing community priorities. And it seems to me really important that more of us do that systematically, and presumably, as you're pointing to, that these exercises are updated and kept relevant, and you know, perhaps there's some sort of a process for us to work out, as you say, across the course of this conference, but they're really, really helpful exercises to do.
Yeah, and I guess one final thing to add is that I completely agree, and I think, you know, these activities to make sure that we're focusing what are unfortunately precious resources on autism research in terms of the total amount of money that's being spent on it are being spent on things that autistic people do care about. And as well as that, I guess, to build on Sarah's point, to make sure that we're being coordinated as a research community. I think far too often we have too many small underpowered studies that don't quite answer the questions that we think they're capable of answering. And if there was a way in which as a community, and this is a big systemic structural change that I don't know how we can bring about in the short term, but could operate in a more coordinated way so that we can do bigger studies that are more kind of complete and tell us, you know, kind of exactly what we think they're going to tell us, that we don't end up with the kind of conclusion section of them all saying more research is needed because this study was too small to kind of conclusively tell us what we wanted to investigate. And I think that's something that, you know, we all kind of need to think and learn about as our discipline matures, I guess. So I'm just conscious that we have come to time. So I wanted to thank each of our panelists today and Sarah for chairing this session. And just as a reminder to everyone who's joined, this session and all of the other sessions from our research festival have been recorded, and they will be made available with captions on our YouTube channel after the festival has ended. So please do tune in tomorrow morning if you're interested. We've got a session on accessing education across the lifespan. And I just wanted to give a final thank you today to our sponsors, Fujitsu, who've made this festival possible. And thank you to all of you for joining and taking part in this really interesting and important conversation. We will be providing some information about this session as well afterwards when we produce the recording online and the questions that you've asked. So thanks again, everyone, for joining and for taking part in this session of the Autistica Research Festival.
Thank you all so much.